Hello everyone, today this is Medicine in 3 minutes and today we're going to be talking about lung cancer. We're going to go over the three major types of cancer, the non-small cell lung cancer, small cell lung cancer, and particular types of cancer, the TNM chart, and treatments. So cancer is the most common cause of death in both men and women. It is the second most common cancer overall in men after the prostate and female after breast. Sorry, should be an A after the E over there. And all forms of lung cancer are associated to smoking except adenocarcinoma, which we will look over in shortly. Major symptoms, we're looking at weight loss, dyspnea, which is shortness of breath and coughing, hemoptysis, which is the coughing of blood, and recurrent pneumonia. Starting with non-small cell lung cancer, there is three major ones. There is squamous cell lung cancer, adenocarcinoma, and large cell. Squamous cell cancer is related to smoking. It's a central type tumor, so meaning it's usually in the center of the lungs, predominant in men, and after the 5-year benchmark, the survival rate, is high. In terms of the paraneoplastic syndrome, you are looking at constipation, kidney stones, parathyroid hormone-related protein, and high levels of calcium. All of these symptoms are triggered by the parathyroid gland, which are located posterior to the thyroid gland. Adenocarcinoma is the only lung cancer that is not related to smoking. It is a peripheral type cancer, meaning it's usually near the edges of your lungs. And the likelihood of developing such cancer are very likely both in men and women at equal rates. You want to conduct a CEA test, which is the carcinoembryonic antigen test, and if it's positive, then it tests positive for adenocarcinoma. In terms of pleural effusion exudate, you also want to test for high levels of hyaluronidase. So if you have high levels of hyaluronidase, it's also sign for adenocarcinoma. The large cell lung cancer is related to smoking, and also it is a peripheral type cancer. The TNM test, only applies to non-small cell lung cancer. So T stands for tumor, which relates to the size of the tumor. So T0 means there is no tumor. T1 is tumor less than or equal to 3 centimeters. T2 is between 3 and 7 centimeters, and T3 is greater than or equal to 7 centimeters. N stands for the nodes, the lymph nodes. So N0 are no nodes, N1 nodal extend in ipsilateral pulmonary, and 2 nodal extend in the ipsilateral mediastina. And metastasis, it's a 0 or 1. So if you have no metastasis, meaning there's no cancerous cells outside the primary site, then it's M0, and then M1 is metastasis, which means it's a positive, positive for metastasis, and that usually means stage 4 cancer. Treatment. So if it's a stage 0, surgery. Stage 1, surgery and radiation. Stage 2 and 3A, surgery, chemo, and radiation. And stage 3B and 4, which means metastasis, and that's radiation and chemo. So now looking at the second major category of lung cancer, which is a small cell lung cancer, also related to smoking. It's a central type cancer characterized by OAT cells, and it's also always disseminated, meaning that the cancer cells are found outside the primary site, so outside the lungs. In terms of the paraneoplastic syndromes, you're looking at SIADH, which stands for the syndrome of inappropriate antidiuretic hormone, and that usually is triggered by the posterior pituitary gland, which secretes the antidiuretic hormone, also known as vasopressin, and that results in low levels of sodium and high levels of potassium. Cushing, which is the opposite of SIADH, and is characterized with high levels of sodium and low levels of potassiums and carbonate. Lambert-Eaton is this dysfunction in the synapse of the nerve and muscle. So the juncture of nerve and muscle, where there is a production of antibodies against voltage-dependent calcium canals, and it is characterized. Usually, you feel pain in the morning, and usually the pain will lessen throughout the day because you're exercising. And that's the opposite of myasthenia gravis. So myasthenia gravis is the same as Lambert-Eaton in terms of the dysfunction of the synapse. However, with myasthenia gravis is the more you exercise, the worse the pain becomes. So if the small cell lung cancer is at an early stage, then chemo and radiation, and then if it's at an advanced stage, it's chemo alone. Looking at particular cases of lung cancer, there is the SVC syndrome, the Herner syndrome, and the Pancoast syndrome. So the SVC syndrome stands for superior venous cave syndrome, and is characterized by blurry vision and distended veins. Distended meaning dilated veins. If we're just going to skip over to the Pancoast syndrome. The Pancoast syndrome is when the tumor is located at the apex of the lungs and it presses against the sympathetic nerve at the T1 vertebrae. Now, if that compression is very, very severe, then it causes Herner's syndrome. So think of Herner's syndrome as the advanced version of the Pancoast. And Herner's syndrome is characterized by three symptoms. Ptosis, spelled P-T-O-S-I-S, which is the falling of the eyelid. Literally, the eyelid has fallen over the eye and almost causes it to close. Meiosis, spelled M-I-O-S-I-S, which is a decrease of the pupil's diameter. So you'll see this pupil is normal. It has a normal diameter, and this one has the circle almost constricts. And anhidrosis, which is the third symptom, and that's decreasing the secretion of sweat. And anhidrosis is spelled A-N-H-I-D-R-O-S-I-S. The conditions in order to perform an open biopsy and remove the nodule are to test to see if the tumor is greater than 3 centimeters, if you notice eccentric calcifications, and if the patient is smoking and an older patient. So I do apologize, we definitely went over the 3 minutes, but that was medicine in 3 minutes. We hope you liked the video, and hope you subscribe.